Scar management is basically taking care of the scars so that they look and feel as good as possible. And as I mentioned, this starts in the operating room and then it really continues for at least the first 3 months following surgery. The first most important thing is taping the incisions. And that can be done with a variety of different kinds of tape. Mostly it depends on the sensitivity of the patient's skin and if they have any allergies. Many people develop allergies to adhesive, and all the tapes pretty much have some degree of adhesive on them. So it's important to find something that it works for the patient. So what does the tape do? It does a couple of things. One of the things that it does is it prevents pulling on the actual scars with movement. So some surgeons tell their patients not to use their arms after surgery or to only use their arms a little bit. I don't subscribe to that. I don't think there's any evidence that that's a good idea. And I think it's really important to have your mobility back and to feel like a normal human after your surgery. So I prefer to use tape to offset any pulling or stretching of the incisions that might happen with normal movement. So how do you put the tape on and what tapes are best? The nicest quality tapes are often silicone-based tapes, and as long as you don't have any sensitivity to that, those are great ones to use. And they tend to be a little bit thicker than a basic paper tape for the skin. And they seem to be pretty well tolerated in terms of any irritation. So in general, if the incision is horizontal, you put the piece of tape just along the incision. And anywhere where there are incisions, the surgical tape can go along those incisions. You don't want to change the tape daily, as that will irritate the skin and possibly disrupt scabs and things from healing. So ideally you want to leave the tape on 5 to 7 days. Most of the tapes are completely waterproof and sweatproof, so you can work out if you're allowed to do that. You can get in the shower, and then you would just peel them off the incisions and replace them. That's a really good thing to do early on in healing. And as I mentioned, it prevents pulling of the scars, but it also compresses the scars a little bit, and that is a shut-off mechanism for the body to stop laying down collagen. So one of the reasons why people sometimes get thickened or what we call hypertrophic or keloid scars is that their body just keeps on putting collagen into that scar and it doesn't shut off. So we've found that one of the things that helps shut it off is a little pressure on the scar or on the incision, and that can help the body turn off that mechanism. Obviously, you want to put enough collagen in there that it'll heal and become like almost normal skin again, but you don't want so much collagen in there that you make a thick, nasty looking scar. So the taping is really important, and depending on how things are healing and looking, you might want to continue taping up to 3 months. And especially if you're very active, because the more active you are, the more pulling there is on the actual incisions and the more potential for widened or stretched out scar. So the tape really helps with that. So that's probably the most important thing. Then the second aspect is massage. And I think massage is important on the actual scar, but it's really important on the whole surgical area. And how do we do massage, and what should you use in terms of oil or lotion or scar gel? So let's go back to massaging scars. So if you are going to massage a scar, many people turn to the products that are out there like Mederma, like silicone gels. So the fact of the matter is, none of these products have any magical powers in them. The thing that's magic is moisture and massage. And the reason moisture is important is that scars tend to be drier than the rest of your body. And when they get dry, when the skin gets dried out, it makes them more fragile. So keeping the actual scars moisturized with whatever you like. If you like oil, that's great. If you like cocoa butter, that's great too. Some people like just a basic lotion. And others prefer something like Vaseline. So any of those products are completely fine. And there's, like I said, there's nothing magical about any of the products. What it is the moisture and the actual massage. As you massage a scar, and how do you massage it? So there are sort of two ways to do it. One is with sweeping motions across the scar, and one is with circular motions above and below the scar. And either method is fine. When you begin massaging, it should be fairly gentle and not with a lot of force or pressure. It shouldn't hurt, it may feel uncomfortable. And one of the sort of weird and interesting things is as you massage, you're going to feel scar tissue underneath your skin. And you're gonna feel areas that are uneven and thick and different than the rest of you. So it's important to massage the actual scars, but then it's also important to massage the whole operated area. So if your chest was operated on, it's important to massage from the clavicles, the bones up here, all the way below where the scar ended, because that whole area is scarred. And you'll notice that by the way it feels, because you'll have some numbness and the sensation will be different. And you'll also notice by how it feels when you touch it, and they will feel different. Some areas may feel thick or firm or even swollen. So the massage helps with a lot of aspects of healing and with improving the scarring. It also helps with improving the sensation. And why is that? And that's because the nerves basically need the feedback to grow back out to the skin, and touching is really great feedback for the nerves. So how often should you massage and when should you start? In general, most patients can start massaging around 4 weeks post-procedure. In some cases, it can be even earlier than that. I recommend twice a day. Once in the shower is a great place to do it because it's easy. You can use soap instead of oils or lotion. And then another time during the day, and about 5 to 10 minutes each time is a really good idea. And I recommend massaging really until things feel normal. Post-surgery, you will have strange sensations. Things may feel a little numb, they may feel hypersensitive. So until your sensation gets back to normal, I think doing a post-surgical massage is really, really helpful. It also helps with swelling, and it helps with the overall appearance of the operated on area. It helps that area not get stuck down, and it helps soften up all the tissues. So massage and taping are the two really primary aspects of scar management.